Welcome back to my channel. I'm Dr. Ethan Brooks, and in today's video, we're exploring deep into the topic of prostate cancer and the latest advancements in early detection. Early detection of prostate cancer can significantly improve the chances of successful treatment. But the most common test, the prostate-specific antigen, PSA test, isn't perfect. So, what are the newer tests that are revolutionizing prostate cancer detection, and how can they help men like you stay ahead of the disease? Let's start with the most commonly known test, the prostate-specific antigen, or PSA test. This blood test measures the amount of PSA in your blood, a protein produced by the prostate. High levels of PSA can indicate prostate cancer, but it's not foolproof. The PSA test has its limitations. It may miss some cancers, and it can also show high levels due to conditions like benign prostatic hyperplasia, BPH, or prostatitis. This means that some men may be unnecessarily sent for a biopsy, while others with prostate cancer may get a false sense of security. As we continue to make strides in cancer detection, the search for better, more reliable tests is ongoing. New methods are designed to not only improve the accuracy of early prostate cancer detection, but also reduce the number of false positives and negatives. So, what options are available? Let's take a look at the most promising advancements. First up, we have the Prostate Health Index, or PHI. This is an advanced test that combines three different forms of PSA: total PSA, free PSA, and pro-PSA. By analyzing these three markers together, PHI can provide a more accurate risk assessment for prostate cancer, specifically for those who may have slightly elevated PSA levels. This test is particularly useful in distinguishing between aggressive and non-aggressive cancers. Another breakthrough in prostate cancer detection is the FORK score test. It combines four key markers: total PSA, free PSA, intact PSA, and human kallikrein-2, HK2. The FORK score not only helps detect prostate cancer but also assesses the likelihood of having aggressive, high-grade prostate cancer. By integrating these markers with your medical history, the FORK score provides a personalized risk assessment that can help you and your doctor decide whether a biopsy is necessary. 3. PCA3 and Progensa urine test. Next, we have the PCA3 test, which measures the level of prostate cancer antigen 3, PCA3, in urine. After a digital rectal exam, or DRE, prostate cells are pushed into the urine, and high levels of PCA3 can indicate a higher likelihood of prostate cancer. This test is particularly useful when PSA levels are mildly elevated, helping doctors decide if a biopsy is necessary. It's a non-invasive method that's becoming increasingly popular. 4. The TMPRSS2, ERG gene test. The TMPRSS2, ERG gene test is another promising development. This test looks for a specific genetic abnormality found in some prostate cancer cells. If you have prostate cancer, the TMPRSS2, ERG gene fusion may be present, but it's rarely found in healthy men. By testing urine after a DRE, this test can help identify men who are at risk for aggressive prostate cancer, even when PSA levels are not significantly elevated. 5. ExoDx Prostate, IntelliScore, and Select MDX. Two other advanced tests worth mentioning are ExoDx Prostate, also known as IntelliScore, and Select MDX. Both tests analyze urine samples to determine the risk of aggressive prostate cancer. The ExoDx test looks at three biomarkers, while Select MDX analyzes certain RNA forms linked to cancer-related genes. These tests can help identify high-grade prostate cancer, and they offer a non-invasive alternative to a traditional biopsy. 6. MyProstate Score 2.0, MPS2. The MyProstate Score 2.0, or MPS2, is a comprehensive urine test that looks for genetic changes associated with prostate cancer. By examining 18 different genes, including PCA3 and TMPRSS2, ERG, MPS2 can assess a man's risk of having aggressive prostate cancer, including grade group 2 or higher. This test is an excellent option for men who are at high risk or who have already had inconclusive biopsy results. 7. Confirm MDX and ISO-PSA. Finally, let's talk about Confirm MDX and ISO-PSA. Confirm MDX looks at specific genes and prostate biopsy samples to assess the risk of undetected cancer, especially in cases where a biopsy didn't show cancer, but suspicion remains high. ISO-PSA, on the other hand, examines different forms of PSA in the blood to assess the likelihood of high-grade prostate cancer. Both tests are helping doctors make better decisions regarding biopsy and treatment. The future of prostate cancer detection. As we look ahead, it's clear that we're moving toward a more personalized, accurate approach to prostate cancer detection. While these new tests are not likely to replace the PSA test just yet, they're already offering more precise results, especially in cases of elevated PSA levels or inconclusive biopsies. By using a combination of these advanced tests, doctors can make more informed decisions and ensure that men are getting the appropriate care at the right time. If you found this video helpful, don't forget to like, subscribe, and hit the notification bell so you never miss out on important health information. Early detection is key, so talk to your doctor about the best screening options for you. Stay proactive, stay informed, and take control of your health. Thanks for watching. See you in the next video.